Welcome to another night of Fresh Natural Live. Happy Labor Day to all of you out there. I imagine many of you are enjoying your time off. Some of you probably had to work today. I did a little bit of both, but tonight we're going to have a brief little discussion on the health benefits of exercise. I think you're really going to want to um, um, not miss this. I'm going to give an overview of an article that I read. It's a pretty long article. I'm just going to give a summary of it. And then I'm going to go through some general, well-known or fairly well-known health benefits of exercise. And after that, I'm going to give you my insight and my approach to exercise. And actually, I'm going to talk about a new program that we'll be starting at Montgomery Heart and Wellness that you'll hear a lot more about later. So stay tuned. Let's get on the other side of the start of the show and let's talk about exercise. Okay, happy Labor Day again, everyone. And we're going to talk about the health benefits of exercise. You know, we all have a general insight of the fact that exercise is beneficial. And we generally know that it's good for improvement of strength and maintaining a healthy body weight and the like. But unfortunately, there's not a lot of science that goes into truly understanding the mechanisms of the benefit of exercise. And so I'm going to review an article that looks at a lot of the available data worldwide. But even in this setting, when I reviewed the article, I found that there was not a lot of detailed understanding in terms of the mechanism of effects of exercise in certain diseases. But they did cover a broad spectrum of disease types. And what I found was that there was a universal, there's a finding of universal benefit of exercise. I'm not going to go through the nuts and bolts of this article, largely because it's a pretty extensive article, but I'm going to leave this title up for a few minutes for you to look at. I would invite you to pull this article out and review it. It's I think it's a reasonably easy read for those who are both medical experts and those who are not. And so I think you'll get a lot out of it. It can serve as a reference. For instance, if you have a certain health condition or have a loved one with a certain health condition, I think you can reference this article and maybe look at some of the studies that they reference and talk about it. So, but before we get into some of the nuts and bolts, I want to invite you to hit the like button or give us a love reaction. And also hit the subscribe. If you haven't subscribed, and share this with any loved ones or friends that you think would benefit from this information. So exercise is medicine. You know, I like the beginning of this title, evidence for prescribing exercise as therapy in 26 different chronic diseases. So what these authors did, they searched the medical literature and they reviewed 26 different types of diseases. Psychiatric diseases, the class of psychiatric diseases, metabolic diseases, cardiovascular diseases, and also pulmonary disease. And they also looked at some data in cancer. And essentially what they found across the board, there was benefits to exercise. So let me just go through some of this. I highlighted some of these, but for instance, if you look at the effects of psychiatric diseases, depression. And depression is fairly common. Many individuals become depressed for different reasons. Many individuals are depressed usually due to, or frequently due to, social events, a loss of a loved one, a loss of a job. There's postpartum depression that women can go through, and there are many other mechanisms of depression. however, they found that clear evidence of exercise improving depression. I can identify personally when I was in medical school, I went through a bout of depression when I was a third year medical school student. But looking back, what I realized that up until my third year in medical school, when I was exercising every day, I started, taking call with the interns and residents. As a medical student, I wasn't exercising. I immediately stopped exercising for a prolonged period of time, and depression hit. Once I started exercising again, it just went away. I never sought any help or got any medication, but I know for a fact personally that it can has a beneficial effect on depression. And many people are depressed for lots of reasons. So you may have a lifestyle that consists of, working long hours, being indoors a lot, not eating healthy, not moving a lot. And so you adapt to that lifestyle and your mental state is what you may consider normal. Then you may get hit with a sociological stressor, if you will. You may lose a job, you may lose a loved one. And then that may trigger a sense of depression because your response to that external stress or external loss may be blunted by the fact that you don't have a healthy lifestyle to start with. So it's understandable how depression can help, or exercise rather can help anybody in the setting of depression. They talk about possible mechanisms. Increasing beta endorphins and monoamine concentrations in the blood are some of those things. And you may think about why people may eat based on emotions. Sugar is one of those things that, has a dopamine effect, has an endorphin effect. So we may eat, bad diets to stimulate those receptors that are not being stimulated normally with exercise. Many of you may be familiar with the runner's high, buildup of endorphin levels and the like. And so you have a situation where when you're exercising, these endorphin levels build up and they give you a sense of euphoria, a sense of well-being. And this happens if you maintain exercise on a regular basis. These levels are maintained and your sense of well-being and euphoria is maintained. So if you're not exercising, these endorphin levels can decrease, and therefore you have a decreased sense of euphoria, and you can simply reverse that with exercise. And epidemiologic studies indicate that regular physical activity helps prevent symptoms of anxiety, as well as depression and the like. Now, they talk about evidence-based training. Most of these studies oscillate between aerobic exercise and weight resistance exercise. Most of the time, aerobic exercise with high intensity, high interval training aerobic exercise tend to be the best. And it really crosses over between aerobic exercise and increasing resistance. So if you do a high intense exercise, you're really doing an exercise that's aerobic, and because it's high intense, there's some level of increase in increased resistance. So if someone's sprinting or someone running upstairs or doing lunges up an incline, there's an aerobic component to it, but also you're doing lunges or running up an incline, there's an increased resistance. So high intensity exercise frequently combines aerobic and increased intensity. So you're really getting the best of both worlds because you want to increase cardiovascular benefit, but you also, with the increased resistance, want to increase muscle mass and certain types of high intensity exercise like lunges and leaping and things like that also help with balance. So we go through the different studies they looked at. I made some notes here for myself. They looked at schizophrenia. Again, a positive benefit with patients with schizophrenia. Again, aerobic exercise was, along with some resistance training, was found to be beneficial, but the benefits lent toward more high intensity, either moderate to high intensity exercise. As I said here, largely aerobic exercise done in small groups. There's also a psychosocial component of exercise when you're working out with groups. That can help people with mental disorders such as schizophrenia, such as as depression, even anxiety. With anxiety, they found that by increasing heart rate and blood pressure, patients became aware or less anxious when heart rate and blood pressure increased, and also it blunted the increase in heart rate and blood pressure. So, for instance, people may get an increased heart rate and blood pressure if they're dehydrated, but if they have a sense of anxiety towards that, then they may become more anxious, and therefore adrenaline increases and the increased heart rate and blood pressure is exacerbated. Dementia, as we have long known, is benefits from dementia, and there's a lot of evidence on the prevention side of dementia. But again, physical exertion, aerobic exercise, resistance training is beneficial, but also things that require coordination. So, for instance, if you're doing dances or certain types of exercise that require coordination, so muscle memory that tax the muscle, I think also has been found to be very beneficial in dementia. So, in that situation, dementia, and similarly, Parkinson's disease had benefit with exercise, aerobic and endurance, aerobic training, high intense exercise. Some resistance training was found to help gait and movement and reduce the rigidity. Stretching and flexibility was also found to be beneficial in patients with Parkinson's disease. As we move down the list here, and then they really found no significant absolute contraindications in most of these. There are some with musculoskeletal disease and some other disease I'll go with, but from the standpoint of mental disorders, no, the neurological condition had no absolute contraindications. Multiple sclerosis, there was benefits found in exercise with multiple sclerosis. Individuals who exercise, again, high intense exercise, interval training was found to be beneficial. Aerobic, but also resistance training was found to be beneficial to a certain extent. In all cases, exercise had to be individualized. So that's an important thing that they came up with. And that goes without saying, someone, despite your disease state, you're going to start off at different conditioning levels. And many of these individuals with psychiatric disorders have other comorbidities like musculoskeletal issues and obesity and cardiovascular issues. And so you always have to individualize exercise. Now, going to metabolic diseases, obesity, we all have a clear understanding that, exercise can help you achieve and maintain a healthy weight. It usually works best when there's a healthy diet. So, you can't outrun, the favorite cheeseburgers or fried foods or whatever the case is, because there are metabolic things that contribute to increased weight, such as increased fat cell, increased fluid retention. That's going to keep your weight up if you're putting toxins inside your body. So you can't just outrun toxic, consumption of food. Even though you may burn calories, you're not removing those toxins effectively if you're eating a toxic diet. So obesity and all of these conditions really work better with exercise and combined with nutrition. And that's what I'm going to discuss with you later. So obesity, they talk about a U-shaped association. Of course, people that are too small have increased morbidity to mortality, as well as people that are too high of a BMI. But the key thing with obesity, aerobic and high intensity interval training is very good for obesity. The interesting thing they found in looking at the data on obesity is that they found that people with normal BMI who were not fit had an increased mortality despite the fact that they had a normal BMI. So an increased mortality twice as much than unfit people, regardless of BMI. And the other thing is that in their studies, and again, they looked at multiple studies, they saw that people with a high BMI who were either overweight or obese but fit did better than people who were non-fit who are not overweight and over obesity. So there's a physiological component that goes with fitness. And what that implies, it implies that when your body's physically fit, there's an underlying biochemical and physiological milieu, if you will, that's favorable to your longevity. And so even though your body is overweight, and the body that's overweight is overweight because you may have increased toxins that you're putting into your system, and the body puts those toxins aside with increased fat cells and increased fluid retention. So you may be physically fit and overweight because you're exercising and getting the benefits of that. But you may not have an optimal diet, you may not be detoxing, etc. So your body may be just putting those toxins aside, so you carry extra weight. However, because you're fit, you're compensating for those things. And so there's a compensatory mechanism that you can have. But to get the optimal benefit of well-being, you want to be fit and be at a healthy weight. So that means optimal nutrition and optimal exercise. Hyperlipidemia has been shown, exercise has been shown to benefit hyperlipidemia. The mechanism here was found to be due to increased lipid metabolism at the skeletal muscle level. And so the training was thought to be beneficial, increasing lipid turnover at the skeletal muscle level. And hyperlipidemia also is related to not only skeletal muscle metabolism, but also liver metabolism, that they didn't see much effects on liver metabolism. I think liver metabolism is going to be affected more by the food that you consume or the food you don't consume. So let's look at metabolic syndrome, which is very closely related to diabetes. Type 2 diabetes is an insulin resistance component there with people who are overweight. Again, high intensity interval training has been found to be beneficial, as well as aerobic training, which high intensity interval training is aerobic, as well as having a resistance component. Resistance training is good. Resistance training is good because it helps you build up muscle mass, and muscle mass helps you build up basal metabolic rate. And so it, over the long run, can help you with weight loss because your basal metabolic rate is increased. Increasing a plant-based diet also increased basal metabolic rate. And so possible mechanism is multifactorial. It affects lipids, it affects hypertension, insulin resistance. Exercise, we're going to go to type 2 diabetes here. Whoops, I think we passed type 2 diabetes, but type 2 diabetes and metabolic syndrome can be lumped together. There's an insulin resistance component that's driving both of those. And exercise is known to increase insulin sensitivity. So that's an important part. And if you're taking insulin, this is especially important if someone's a type 1 diabetic that also benefits from exercise versus type 2 diabetes. If you take an insulin or some agent that lowers blood sugar, monitor your blood sugar carefully, because if you start exercising aggressively, you need to make adjustments, and the medication you're consuming that lowers blood sugar. Polycystic ovarian syndrome is a condition diagnosed in women with multiple cysts on the ovaries. It's associated with hormonal imbalances. Insulin resistance is among the findings that they have. There's syndrome of infertility, insulin resistance, obesity, and hirsutism, or increased excess hair growth. That's described in the syndrome. But the metabolic impact of exercise is similar to that with type 2 diabetes, increasing insulin resistance, and these patients benefit from it. As I mentioned earlier, type 2 diabetes is very similar to metabolic syndrome, and they also show benefits on type 1 diabetes. Now, type 2 diabetes is an insulin resistance syndrome. Type 1 diabetes is an autoimmune type disease in most cases. Now, you can have a chronic burnt out pancreas for metabolic reasons as well, but most of the time we see type 1 diabetes as an autoimmune process where the immune system attacks the pancreas. It's essentially scarred down, it's ineffective, and you're required to take insulin. The benefit in type 2 diabetes, as I mentioned, insulin resistance is reduced. There's some other metabolic benefits. Certainly weight reduction is helpful, and that also contributes to insulin resistance improvement. Type 1 diabetes, however, there's a benefit that's at the lipid metabolism level. So they showed there was some decrease in overall cardiovascular risk, but this is not necessarily due to the fact that there may be a decreased requirement of insulin as well, because people with type 1 diabetes, if they're leading the standard American lifestyle, there may be some insulin resistance in addition to the fact that their pancreas doesn't make insulin, so they require a large amount of exogenous insulin. So we know from a nutritional standpoint, when we put them on an optimal diet, they have a lower insulin requirement. And the same thing is seen with exercise. So you put those two together, you require less insulin, which has benefits. And other things like hypertension and hyperlipidemia, these things are affected favorably in this condition as well. There are some precautions and contraindications, both in type 1 and type 2 diabetes. If you are on an insulin-lowering medication, then you can drop your blood sugar lower than need be. So very high, very low blood sugars in both cases are contraindications of starting exercise. So again, as we take a break here, hit the thumbs up button, hit the like button, share and subscribe, and share this with loved ones and anyone you think will benefit from this important information. Hello, everyone. See Mary McCoy, Danielle Harding, Leon Dantzler, Karen Evans, Dennis Glenn. Dennis Glenn said, I saw a big drop. In my blood pressure. I went back to running. My BP today is 130/60. I haven't seen that in years. Awesome. Keep that up. More evidence for what we're talking about. And so there's a question about, does the study favor muscular legs? Yes. If you run heels and do weight training for the legs, your legs can become more muscular. Greetings to Blind Guy, his wife, their life. I met you guys in North Carolina earlier this year. And Daniel Harding, yes, I agree. Thumbs up, thumbs up. And thank you for the reminder, Danielle. So again, cardiovascular diseases. Now, cerebral apoplexy, based as a condition where you have stroke, cardiovascular accident, apoplexy. Someone's had a stroke and have neurological or neuromuscular problems or mental disorder. First, there's physical therapy and rehab over that. But as one recovers, exercise has been shown to be helpful in this condition as well. So there's some evidence benefit of exercise. Type of training is going to be focused on walking, cardiorespiratory training, and just improving baseline physical function. But as that part occurs, then you want to go to the next level. Oftentimes in medicine, we get a person that had a stroke and they go get them back to, say some modest level of functioning, and then we stop there. I mean, insurance companies stop paying for physical therapy, et cetera. And oftentimes in my patients, I recommend, okay, you've gotten your physical therapy, you recovered at this point, now you need a trainer. You need to get out and move. You need to get out and work out. And I've had patients before, I had one patient in particular who had a stroke and was paralyzed on one side, and I had him working out with my trainer. And he was outside, walking heels and doing workouts and things, pushing the limits. And he benefited from that. Hypertension, we know that the normal physiological effect of hypertension, you decrease diastolic blood pressure, systolic blood pressure goes up during exercise. But overall, exercise can have a definite benefit in terms of reducing blood pressure. You want to be careful, of course, if you have someone with malignant hypertension, blood pressure is very high. You want to be careful with that because you want to make sure that it doesn't exacerbate it. And so when we see patients with hypertension, I will actually have them walk on a treadmill, see what their blood pressure response to exercise is. And depending on what that response is, I'll start an intervention. Here they talk about starting medications. I'm going to give you my take on that shortly after I kind of just go through this laundry list. So hypertension benefits from exercise, coronary heart disease, reduce in inflammation, reduce in plaque. There's some physiological benefits that improve coronary flow, coronary artery function. So that improves blood flow to the heart muscle and improves cardiac function. Types of training, aerobic exercise, you want to start off with some high intensity training. So high intensity training I like a lot because It's mostly aerobic, and you can, but there's some resistance components to it. So walking a hill, or climbing a hill, or running a hill, walking stairs, and doing an interval. So you have an intense period and then rest, an intense period and rest. I like that because there's an aerobic component to it, but the intense period is intensity in terms of, the fast component to it, but there's also increased resistance because oftentimes you may be lunging, whether it's like body weight lunging or, weight assisted lunging. Those are types of high intensity workouts that you're going to do. That's not only going to improve aerobic function, but also going to improve muscle function. Congestive heart failure is found to benefit from exercise. Oftentimes we have a heart failure patient lay down, don't do anything. No, I get my heart failure patients out and walking. One of my patients, she was in a hospital, severe heart failure. She had severe, regurgitant mitral valve and what have you. I put on the detox diet. We got off the Melanoma, got out of the hospital, and we had at the office, we would take her out and walk her and have her, walk stairs in the back. We have like a detention area there. We have her walk down into the detention area and up the detention area. And she got some benefit from that. And so exercise can be very beneficial for people with heart failure, congestive heart failure. And so you think these people need to rest? No, they need to get out and work out. But this needs to be in the context of a nutritionally rich, enhanced diet. I'm going to talk about that as I go through this. Intermittent claudication, that's due to poor circulation in the legs. That benefits from exercise. Walking is what they looked at the most, but step training, I think, can also help. Walking on a treadmill, doing walking up steps, or just doing a step exercise, go up the step, on the step up, step down, step up, step down. Those types of things. You want to go past the pain threshold. It helps improve vascular flow. It helps the body, lower extremity, improve circulation, etc. Hello, Katie Miller. How are you today? Welcome. Happy Labor Day. And so pulmonary disease is chronic obstructive pulmonary disease. Now, exercise was not found to decrease the inflammatory component of pulmonary disease, but it did improve chronic respiratory function, which was thought to be due to the fact that improving cardiac function, also skeletal muscle function. So your diaphragm works better, your heart's working better. So your cardiorespiratory function overall is better. Bronchial asthma has been shown to improve. Cytokines, systemic cytokines, and TNF alpha has been shown to be reduced with exercise. And this could be the mechanism by which it helps with these inflammatory conditions, such as bronchitis and even cystic fibrosis. There was some benefit in patients with cystic fibrosis. But in all of these cases with the pulmonary disease, they strongly emphasize tailoring the exercise to the person's functional capacity. And that goes without saying, to be honest, with any of these conditions. Osteoarthritis. The emphasis of osteoarthritis and rheumatoid arthritis is that you have, osteoarthritis, sort of degenerative joint disease, rheumatoid arthritis, an immune-mediated joint disease. And they're very common disorders, particularly osteoarthritis, and they benefit from exercise. Now, the emphasis with both of these arthritic conditions is that you don't necessarily want to exercise the joint immediately unless there's rehab, range of motion. But for instance, if somebody has osteoarthritis of the knee, you want to exercise the hip and improve hip muscles or the muscle strength around that knee. That's going to help out with balance. So if you improve hip gait and strength and flexibility, that'll take some pressure off the knee, because oftentimes individuals may have more pressure on the knee because you have other joints that you're compensating for. And so improving the mobility and function of those joints around that, what seems to be the affected joint, can help that joint. Decrease in inflammation may also be a mechanism, although they do not see a direct correlation in things like decreased synovial fluid inflammation, et cetera, with the exception of a few synovial fluid biomarkers. Osteoporosis, we've long known that osteoporosis, certainly from the prevention side, benefits from exercise. Weight-bearing exercise are going to be the key exercise here. But of course, aerobic exercise is beneficial. And back to the intermittent, the the um, um, the intensity, high intensity exercise, where you're doing high intensity rest, there's both aerobic and weight bearing components to that. So walking, weight bearing, lunges, weight assisted lunges, climbing hills, climbing stairs. These are the types of things going to help osteoporosis, some weight training as well. Back pain is benefits from exercise. We have a patient that we are working with now with back pain, and we're giving him some exercise to do. But these inflammatory conditions, whether it's inflammatory condition of the lung, inflammatory condition of the back, you have to have an adjunct, strong adjunct that decreases inflammation. We'll talk about that in a minute. Back pain, again, benefits. Now, there are different forms of back pain. Most of it's chronic degenerative back pain due to osteoarthritis. There are different subcomponents as ankylosing spondylitis they talk about here, or Bechtereau's disease. Again, these are inflammatory conditions that have special clinical syndromes. Essentially, back training, exercise benefits the back if you improve core muscle strength, doing things like planks and things like that. The things that improve the core can also benefit. They talked about a variety of exercise, but things, aerobic training, high intensity exercise will also help with weight loss, which also may help with back pain. Rheumatoid arthritis, similar to osteoarthritis, you want to work joints around those joints, not directly affect the joint that's inflamed. Also, with back pain, you want to make sure that someone doesn't have an acute fracture. And similar to osteoarthritis, you want to make sure, and rheumatoid arthritis, you don't have an acute flared joint because you can exacerbate that. Cancer is a group of diseases, so it depends on what kind of cancer you have. But exercise in general, and we did a show on this before, how exercise improves mitochondrial function and it improves mitochondrial effects on the immune system. So, and also in some of the other studies, they show how inflammatory markers, cytokines, tumor necrosis factors are reduced. Exercise also improves circulation, blood flow, so the immune system can go and attack the cancer considerably. So systemically, there are about physiological effects that are beneficial from exercise that favors the control of cancer, as well as some biochemical effects. So that's an overview of this. And also one thing about the amount of training, most conditions, they recommend at least 3 days a week. But there were some conditions, such as the metabolic conditions, where there was a desire for weight loss and insulin resistance. They recommend 7 days a week in some cases. So at least 3 days a week. I would say start off 3 days a week and work your way up to 5 or 6 days a week, depending on the condition. And what I recommend, you can go into certain phases where you exercise more intense, and sometimes and other times you back off. So here's a laundry list. You can do a screenshot of this where you have the general laundry list of things that exercise benefits. Is a list of 20: reduced body fat, increased lifespan, oxygenates the body, strengthens muscles, manages chronic pain, wards off virus, reduces diabetes, strengthens the heart, clears arteries, boosts mood, maintains mobility, improves memory, improves coordination, and strengthens bones, improves complexion, detoxifies the body. There's a detox effect with exercise. We've seen that before. Decreases stress, boosts the immune system, lowers blood pressure, and reduces cancer risk. So there you have it. Now, what I want to do is I want us to take a short break, and I want to come back and give you my perspective on this, because we actually have been using exercise in an informal way in my practice, and we're starting a new program that I'll talk to you about briefly tonight, but we will talk about a lot more in the coming weeks. So why don't we sit tight, and I'll wrap it up with my perspective and some recommendations, things in which you can do if you want to start, today or tomorrow.